Hello everyone, welcome to my channel, and in today's video we are going to discuss gastroenterology referrals for the purpose of UKMLA exam. So in this video we are going to have a look at which patient we need to refer immediately to the accident and emergency department, which patient should be referred via the 2-week wait pathway, which is known as the urgent referral, and which patient should be referred routinely. And the timeline for routine referral can be anywhere from 1 month to a few months, okay? So, regarding immediate referrals, these patients are referred immediately to the accident and emergency department from the GP clinic. And the first one here is suspected intestinal obstruction. So, the history here is going to be of absolute constipation. Okay. So, the patient is not passing any stool or any wind, and there is abdominal pain associated with nausea and vomiting. Okay, so this patient you are going to immediately refer to the accident and emergency department. So this was absolute constipation. Then regarding diarrhea, so patients with severe diarrhea with signs and symptoms of dehydration, like tachycardia, dry mucous membrane, and hypotension, these patients you need to refer to the accident and emergency department for IV fluid resuscitation. Then any patient with acute upper GI bleeding, all cases of acute abdomen, so acute pancreatitis, acute cholecystitis, acute appendicitis, acute mesenteric ischemia, or patient with a history of peptic ulcer who is presenting with severe abdominal pain, severe epigastric pain with gardening and rigidity, which will mean that there is peptic ulcer perforation. Okay, so all these patients you need to refer immediately to the accident and emergency department. Then patients with acute severe colitis. So this is mostly in inflammatory bowel disease. The patient present with bloody diarrhea with more than 6 bowel movements per day, along with elevated ESR and CRP. Of course, in the GP clinic, you cannot do, you can do ESR and CRP, but the result is going to take some time. Like in GP clinic, you first need to take blood and then send the blood to the hospital, and then the blood is processed there, and then they send the result back to the GP clinic. So it takes anywhere from few days to few weeks. So any patient in which you are suspecting that there is acute severe colitis, he's having blood diarrhea with more than 6 bowels movement per day, you are going to refer him to the accident emergency department, because this patient is soon going to be have signs and symptoms of systemic instability, because he's losing a lot of fluids and a lot of blood. Okay, then urgent referral. As we all know, all suspected cancers are referred via the 2-week wait pathway. So all suspected GI cancers, we will refer them via the 2-week wait pathway. Okay, then any patient with suspected cirrhosis, we are going to refer them urgently via the 2-week wait pathway. So suspected cirrhosis patient can be patient who are severely alcoholic and now they are presenting with signs and symptoms of liver decompensation, or patients who are diagnosed with known patients of hepatitis B and hepatitis C, who are now presenting with signs and symptoms of decompensation. We are going to refer them urgently, okay? Then routine referrals include a lot of things, but for the purpose of UKMLA exam, we'll discuss these two common conditions. So celiac disease and inflammatory bowel disease, we refer them routinely, and the routine referral timeline is anywhere from 1 month to a few months, depending upon the pressure on the services. Okay, so if there is more pressure on the services, it's going to take more time. If there is less pressure on the services, it's going to take less time. Okay. Regarding IBD, the inflammatory bowel disease, we are going to refer them routinely unless they're present with acute severe colitis, which is more than 6 bowel movement per day, along with signs and symptoms of systemic instability like low-grade fever, tachycardia, hypotension, etc. So that was all about gastroenterology referrals. I hope you found this video helpful, and please like and subscribe to my channel for more videos.